want to start with, as Dr. was speaking, I was like, most of us have gone for internship. Maybe you're going for internship, or you've gone for internship, you've done your hospital rotation. And I remember my rotation at Post General. And I know that Kenyans need access to good medicine, and we also need access to health information. I was just making a joke there that when he's asking questions, si hata tuulize nani bwana ulizwa na relative yake kama anataka abortion. Like that one, everyone will raise up their hands. Like, hey, who has had a relative call them and tell them, I have a cough, what can I take? Because people are not health lit, like there's no health literacy, and we need to ensure that. For me, that's one thing that I'm hoping and I'm passionate about, that at the end of the day, the patients be able to know what they are doing. They'll be able to discuss with the doctor when they go to see a doctor. Have you gone to see a doctor and you're just being told things and you're like, I'm a whole pharmacist and still I don't understand what you're saying. So we need to do that. So quick exercise. Go on Google and right now on your phones. And let's look at self-care, the definition of self-care, WHO definition of self-care. Google that, WHO definition of self-care. Got it? Anyone? Who has 5G network? Got it? Anyone to read for me? WHO definition of self-care. I promise it's not going to the spa.
We have someone here.
I promise it's not going to the spa or making your nails, but it's part of it. Yes.
So self-care is the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider.
With or without the support of a healthcare provider. Let that sink in. So, I'm here to talk about consumer regulatory affairs in the space of consumer health, and that's where we start. We have consumer health products. Our products a consumer goes and knows they need, because they have interacted with this before. For example, if you have a sprain, or if you have a headache, or you have a little sniffle, right? You automatically know, okay, I can go to the supermarket, I can go to the kiosk, I can get 1, 2, 3, right? Now that is self-care. And that product that you pick is a consumer product. It's a product, yes, regulated, manufactured in the pharmaceutical way, or maybe in the food supplement way, but you can administer yourself. You can read the label and say, okay, my pain level is not that much, or you can read and say, oh, I need vitamin C, or I need vitamin D, or I need calcium, and you can self-administer. So those are what we call consumer products. Many companies do make them, and you have seen a lot of them, especially after COVID. During COVID is when people knew there was self-care. When you couldn't go to hospital, that is the day you knew you could buy medicine over the counter with the help of a pharmacist, or you could just pick the medicine and go to the counter and pay for it, right? Yeah. So that is what consumer health care means, right? So I'll just talk about a few things that I do in the consumer healthcare space. When we're talking about regulation of consumer healthcare products, we are lobbying not to be regulated like vaccines. Yes, I have said that. Because we have very, when you go into the consumer healthcare space, the innovation is not really around the molecule, it's around the usage. So you'll find we are now including some medical devices to help you apply your product. We are putting it in easier packages for you to carry around. We are making smaller packages so that you can be able to use them before you go to the doctor. So those are the innovations around consumer healthcare products. These products are normally safe, right? That's why we trust you to administer for yourself. They're normally safe, and they're molecules that have been there a very long time. And therefore, we have actually been saying that consumer health products need to be regulated with less stringent measures, maybe using reliance method, recognition methods, or even risk-based evaluation. You will know more about risk-based evaluation as we go on. But we also have realized that because these products are used by people like you and me, you need to know about them. Therefore, many countries in Africa have not been allowing advertising and promotion of this product, but we are working with the trade associations to change this so that we can be able to let the consumers know how they can use the product, when they can use the product. You know, let it be on TV, let it be on radio, let it be on billboards, because it's a consumer product, right? Also, health literacy. What do you do when you buy that product? Most probably, if you buy it when there's no pharmacist around, you'll definitely buy it maybe in a supermarket or in a general store. So you need to read about the product as a patient or as a consumer. So we are also lobbying for health literacy policies to be put in place. Maybe in support of that, we also do e-labeling, meaning when you, I'll give a comparison. When you have a prescription-only medicine, when you get it from a pharmacy in a hospital or a health provider, you have a PIL, a patient information leaflet inside. That PIL, I don't know how many of you read PILs. Do you read? Okay, I'm hoping you guys read because you're pharmacists. But if you ask me, the people, once you write that label, people don't read that PIL. Once a pharmacist writes Bili Maratatu, it's over. Or once you transfer that medicine from the original pack to a brown envelope, it's over. Right? So we need to find ways and means of communicating this information to consumers. We found in Africa that the phone, just as you Googled, can be used. Post-COVID, we've seen you can go to a restaurant and you can put a QR code and we can see everything on the menu, right? And you can go and pay for parking with a QR code nowadays, right?